Hi, this is Laura again. Welcome back to our Nurse Navigator. So let's look at it from a different scenario. Say you came into the emergency department with complaints of influenza-like illness, but the Nurse Navigator found that maybe your heart rate's a little too high or your oxygen saturation's a little too low. She would then guide you to our specialty area or our main ED. This is where further workup can take place. You can be placed on supplemental oxygen, or if high flow is needed, then this is where we would have our negative pressure rooms. An emergency room tech would take you through a special entrance because we have non-influenza-like illness patients in our waiting room. So you can see that we've really put a lot of thought into making sure that cross-contamination could never occur.
Here in our specialty area, we're prepared to care for individuals who present with worsening flu-like symptoms such as trouble breathing, decreased urinary output, dehydration, uncontrolled fevers. Our emergency room has 49 rooms. 11 of them are negative pressure, which are reserved for individuals who require life-saving interventions such as intubation. We also use these rooms for high-flow oxygen. You'll be met by a team of nurses and doctors. We have one nurse to every 3 patients. You'll be seen by our ED resident and our ED attending. So you will be seen by 2 ER doctors.
Hi, my name is Kelly. I'm a nurse in the emergency department. I'm here to talk about personal protective equipment, also known as PPE. We have plenty of PPE in our department. At minimum, we're all wearing surgical masks and eye protection all day. And then for intubations, we wear N95s and PAPRs, as well as for high flow. We use the buddy system for donning and doffing to make sure that we're all safe and not contaminating our clothing when we take off our protective equipment. If you need some help, Lori's always there watching.
Hi, my name is Beata. I'm also a nurse here in the adult emergency department, and I will be talking to you about social distancing. As you can tell in the picture above, we do practice social distancing at the nurses' station. This includes spaces between the computers. We also practice social distancing in our break rooms, only a certain amount of people at one time.
This is an example of an ante room that Shannon previously mentioned. This ante room or antechamber is a smaller room or a vestibule that serves as an entryway into a larger space. So in this case, this entryway leads to a patient's room. This room that I'm showing here in particular is a negative pressure room. So the ante room is used to, when you enter, you put your PPE on, and when leaving, you take it off and dispose of it appropriately to avoid any cross-contamination or opportunity for cross-contamination. So ante rooms are very important when you are performing aerosol generating procedures such as high flow. We found that high flow nasal cannula is very effective. In fact, it's prevented patients from having to be intubated. So the reason that I put these two together is because when you're using high flow oxygen with warm humidified air, it generates a higher concentration of the infectious respiratory aerosols. So that is why the extra layer of protection with the antechamber. And then you want to make sure when you're in a space that is using an aerosol generating procedure that you do not walk out of a room with that PPE on. So that antechamber is where you're going to doff or take off that PPE. And of course, then wash your hands and leave the space. And this will avoid cross-contamination.
Hi, my name is Megan, and I am one of the other nurses in the adult emergency department. As Silas just took you through the ante room, the room inside of the room, I will bring you through our specific intubation room, which is room 41. Pictured in the top right-hand corner is the ante room that Silas was referring to. After you walk through the ante room, you will find room 41. On the wall to the left, you will see a checklist that describes all of the material and people that should be present for the intubation process. If intubations are a requirement for our patients, this room is designated especially for them. It is designed to cater to a smooth intubation process by avoiding any type of exposure that can be transmitted to our patients and to other staff. It is equipped with a checklist, as I was saying in the left-hand corner, that demonstrates all the required materials and individuals that are present. And as you can see in that list, it includes all of the intubation materials as well as the crash cart, and then pictured on the right are all of the people that should be present so that we are avoiding any type of exposure with too many people in the room. We also have radios that are set up that we use to communicate to each other so that the least amount of people are exposed to the patient during the intubation process. All of these materials that are pictured on the left-hand side, as well as our crash carts, are checked multiple times a day to ensure that we are set up for a smooth intubation process. And then as you walk out of the room, there is a don and doffing station that includes the right process to take our materials on and off to ensure any type of other exposure to ourselves and to other patients.
Hey, George here again. Rooms 39, 40, and 41 pictured here are some of our critical care areas where we will do advanced airway procedures such as intubating patients and giving also more high flow treatments. The area in between these three rooms is considered an ante room when those two doors are closed. So it's a safe area for us to prep things before we go in to treat the patient, as well as to change out of our personal protective equipment when we leave. Welcome to the ambulance bay, also known as the garage. We've repurposed this area from normally housing our ambulances to housing patients. We have full-time nursing coverage, full-time physician coverage, as well as everything you would need to take care of them.
Hi, this is Kelly again. For patients who are suspected to have COVID or who are COVID positive, we want to minimize our time spent in rooms. So what we've been doing is using FaceTime. One monitor will be in the room facing the patient, while the other monitor faces their nurse. That way we can communicate with the patient at all times and keep a close eye on them. We also use this FaceTime option to contact family members or visitors who cannot be with the patient.